So there's plenty of ways to lose weight, but only really one way to lose fat and keep muscle, which is really what it's all about, right? The problem with losing weight is people lose their weight by eating less, they lose muscle, and then their metabolic rate drops, and then they go back to eating what they were eating before, and somehow magically they expect the weight to stay off. I'm Dr. Jonathan Burg. I'm the founder, formulator, and creator of Cornerstone Wellness. A group of doctors and myself 18 years ago developed a program based on the 5 pillars of fat loss, muscle maintenance. The first pillar is protein. Protein does 2 things. One, it maintains your muscle mass, which is where you get your metabolic rate from, so that you're not dropping your metabolic rate and just setting yourself up for a kind of roller coaster of weight loss, weight gain, weight loss, weight gain. The other thing that protein does is it satiates. You're just not hungry when you eat enough protein. And, carbs are just the opposite. No one can eat just one. So protein sets your satiety, so you're not going to be snacking. The shake we made is the most nutritious. It's a medical shake, although as of a few months ago, we actually made it available to the general public. It's got the highest branched chain amino acids. It's delicious. Everybody loves it. It's got 200 to 500% of the RDA of vitamins and minerals. The other thing about the other pillar is micronutrients. A lot of people that are eating primarily white food, fast food, that kind of thing, they're just not getting their vitamins. And because of that, they're having to eat more food to get those vitamins. So what we did was we made the highest vitamin mineral shake, the same shake. You've got 200 to 400% of the RDA vitamins and minerals. We've methylated our B12 and folate for people that can't handle regular B12 and folate. It's got 7 fibers, so you don't get constipated like you do on most shakes. Medium chain triglycerides for satiety and energy. A bunch of micronutrients that help with antioxidants. So that's the micronutrient aspect. That's the second pillar. The third pillar is carb craving. So without carb craving, there never be any obesity, right? People don't get fat eating steak and apples. They get fat eating carbs. So this is Metabolism. Metabolism was developed specifically for carb craving. It does a bunch of stuff. It decreases the sensation of sweetness on the tongue, so you're not getting that sweet hit. It blocks the conversion of sugar to fat. It decreases absorption of sugar, which is basically coming from starch as well. So you're kind of getting rid of it, and it's not sticking around and increasing your insulin levels. It lowers hemoglobin A1Cs in diabetics. Just all these other aspects of carbohydrate metabolism. That's what Metabolism is about. The fourth pillar is inflammation. Almost everybody that's got excess body fat, particularly in their gut, which is what we really care about, your gut fat is creating all kinds of inflammatory, what we call cytokines, which is inflammatory molecules that are causing things like rosacea, heart disease, probably Alzheimer's, all kinds of cancers, etc. So what we're trying to do is decrease inflammation, and the parent anti-inflammatory in the body is omega-3, which comes from plants and things like algae and plankton. The fish are eating all this, and that's where you're getting so they're concentrating the omega-3s for you. What we did with our omega-3, the biggest problem with omega-3s, some of you have tried it before, is the taste, the smell, the fish burps, and all that kind of stuff. The way we got around that was we processed the omega-3 under a nitrogen blanket, so it never gets oxidized, which is the same thing as going rancid. The other thing is impurities. The ocean's full of mercury, PCB, dioxins, all this other crap. We're the only ones that do a triple molecular distillation, so you're talking about parts per billion on these impurities rather than parts per million. We put it in a hard blue glass jar so UV light doesn't get to it and air doesn't get to it because glass doesn't breathe. The last tenet, the last pillar, is exercise. So nobody really likes to exercise, but some people do. But the key to exercise is getting in the last rep. Every time you do, let's say, for example, push-ups, you want to get that last rep where you're not, you can barely make it. That's the only way to build muscle. And you're getting all this protein, so you might as well put it to use by doing all this exercise. These aerobics where you're on a hamster wheel for half hour, it just doesn't work. You want to run fast. You want to lift as much as you can, as many times as you can, and each day you do a little bit more. So that's basically the 5 tenets of Cornerstone. Again, it's been only available to doctors for 18 years, and now you can actually get it through our website.